So the focus of my research is around young people who've experienced serious adversity and trauma in their early lives, and understanding how that affects them as they grow up and what we can do to help them to grow up to have happy and successful lives. So I'm particularly interested in young people who are care experienced, so that is grown up in foster care or kinship care, residential care, or those who are living at home but under a supervision order, which means social services are supervising that family and putting in extra support. So a project I'm currently working on is with a third sector organisation who have recently introduced trauma-informed practice. So this is a model that's designed to help a whole service structure and the staff within it to understand that many of the people they'll be working with have experienced trauma, and that indeed many staff have experienced early trauma as well, and for the whole way the organisation runs to be designed to acknowledge and work with those trauma experiences. So my work specifically has been to evaluate the impact of that practice model with the organisation in terms of understanding the effect it's had on staff well-being and quality of working life. I think it's quite an important piece of research because it helps us understand what services working with children in general need to be doing in order to make sure that young people's needs are properly met, so what they need to be doing with staff and the way they organise the service. I've also been doing some research with kinship carers, foster carers and residential care workers to understand their experiences of working with complex young people. I have some quite ambitious hopes for my research in terms of the impact it might have. Care experienced young people have some of the worst outcomes in society, so they're more likely to end up homeless, more likely to be unemployed, more likely to have their own children taken into care, and have significantly higher levels of physical and mental health problems and drug misuse problems. And there's, I suppose, a kind of a constellation of complications that they experience in terms of really quite severe early life experiences, but then the disrupted care experience of going into care and placement changes, which all comes together to set them up for an adulthood that's going to be filled with difficulty. And my aspiration is that my research will, along with lots of other people's research as well, will contribute to services and individuals and society as a whole knowing better how to support young people to overcome those early experiences and to be able to use the resilience that they have in order to have happy and successful lives as adults. So I'm particularly interested in developing novel interventions for care experienced young people that help to improve their well-being and their resilience. So I'm really welcome any students who are interested in contributing to those projects or who bring their own ideas. I run a research group called LAC Lab, which is a collection of masters and doctoral students and early career researchers and other staff who are all working with this population. So there's a very supportive community that any students coming to do a PhD in this subject will be joining.